Good morning.
Morning.
How's Cali?
It's good. I've escaped the blizzard-like conditions in North Carolina, and by blizzard-like conditions, I mean half an inch of snow and a total citywide shutdown.
So we have been out of school in Charlottesville. Granted, we did get about a foot of snow, but we have been out of school for a week and a half with no plausible strategy to return to school.
I'm still waiting for my county tax rebate for all these missed days of school that my tax dollars have supported.
That's not going to come, probably. Should we hop in?
Let's do it.
All right. We don't have Paul, so I guess we ideally would come up with a cheesy transition phrase. I don't know. Let's get it. Or I don't know. Let's get after it. Who knows?
Let's kick it.
All right. Let's kick it.
Welcome back to HealthTech Remedy, the podcast where three physician leaders unpack what's actually working in health technology. I'm Trevor Royce, radiation oncologist with a background in AI diagnostics and real-world evidence.
And I'm Tim Showalter, radiation oncologist, former medtech entrepreneur, and currently working at the intersection of AI, clinical workflow, and health system adoption. Missing in action today is Paul Gerard. We will have to do our best without his insights on reimbursement policy, market access, and the economics of AI-enabled healthcare. So Trevor and I will be a little bit on the struggle bus, but I think we've learned enough from Paul over the years to provide some perspective.
I think we'll have Paul when we do the interview with athenahealth for the interview session, so that'll be good to have Paul's insights there. So today we're going to chat about athenahealth, obviously, and this is in the health technology world, probably one of the more historically renowned and famous and innovative companies in health technology across the board. They've been around, I think, since the mid-90s when they were founded. And so that was, in the world of paper charts. And so they really have done a lot to advance technology in healthcare, particularly in the EHR and applications for the EHR.
Yeah, it seems like they've carved out an interesting space in the ambulatory setting, whereas I think the other BMF obviously is more focused on the hospital setting. And I think it's really interesting recently how Athena has really carved out a role at the intersection of documentation and billing, obviously, as well as patient engagement and using AI to power some new performance for their products. And it's all inside a cloud-based platform. And so I think their adoption is pretty remarkable. And it's, I think for myself as a clinician who practices at a large academic medical center, it's not something that I knew about until relatively recently.
Yeah, it's pretty cool to see the history arc of a company like this, where they came on the scene in the 90s, pre-EHR, and then have gone through this story. I'm sure we'll get into some of the details here in a bit, where, they went public, became private, they started an OBGYN. Now there's so much more than that. So it's just cool to see how companies can adopt and thrive, and there are these sort of living entities over time.
As you pointed out, they've been around for a while. They were traded on NASDAQ for years under ATHN, and then they were taken private by Veritas Capital. And, that deal was reported as having maybe a value of almost $6 billion. And then there was another acquisition in 2022 by Bain and Hellman and Friedman for $17 billion. So obviously this is a, major player in the space, and their valuation is obviously supported by a broad level of uptake.
Excited to have Paul Brient, who's the chief product officer. He's been at Athena for a long time. So we'll hear more about kind of how they're adjusting in this world of AI. I think they're well positioned for that, given their focus on the electronic health record and sort of their history there, but also in a world where the EHR is so much more than just documentation. You're using things like ambient dictation, revenue cycle management, informing, and the like.
If you're not familiar with athenahealth, maybe you're like me and you practice at just a large hospital-based practice, but it's important to know that it's one of the largest ambulatory EHR vendors in the entire country. Roughly 7% market share. So that's real numbers, trailing behind only Epic and eClinicalWorks in outpatient care. So they're real bona fide. And it's not just the share of the market they have, it's really the way it's designed as well. So it's a single cloud-based network. So they've got over 140,000 ambulatory providers. They're in all 50 states and multi-specialties. So over 120 specialties are represented.
They're processing over 300 million claims annually. And their flagship product, Athena One, they sort of frames this all-in-one software platform. So it's got the EHR, which I think is probably the backbone of all this, but then you can have practice management on top of that, the medical billing side of that, dealing with claims denials, prior authorization, revenue cycle management, like, all these topics that we've talked about on Health Tech Remedy, and often about products that focus on specific ones of those verticals. But this is sort of an all-in-one platform that they highlight.
So it's actually like a management of billing that is built into the system. I've seen on their reports they've got metrics about the clean claim rate. So they're obviously working to verify claims submitted against the documentation, and they've reported a lower than average median denial rate too for claims. So showing that obviously using that platform to embed some intelligence into the system provides some benefits.
Yeah, I think they're a good example of what we've talked a lot about on the show, where, you have your product, and often that product is fundamentally, processing data in some way, like serving as a tool for documentation for the electronic health record or whatever it is. But then the data itself that flows through this system that they built becomes an asset. And so they can use that data for all sorts of interesting use cases.
Yeah, and I think like when it's integrated, for example, if you're thinking about what are the workflows and like what's going into your documentation, it's obviously really important to have it all integrated so that you have a sense of if you provided a service, have you appropriately documented it, and can you bill the appropriate level against that? And so I think there's some real advantages to having the end to end flows built in.
And of course, ambient dictation is a huge topic for providers. They're focused on ambulatory care clinics. There's a ton of documentation in that. There's a lot of burnout related to that documentation. And so, unsurprisingly, they have their product Ambient Notes, which is basically an ambient dictation service to reduce the documentation burden and that idea of pajama time, which we've talked about a couple times on
Yeah, back to pajama time.
the more depressing concepts in healthcare. The idea of doing your notes when the kids are in bed at 9 p.m. at night so you can be ready for your next clinic day.
The other thing that's nice to see is this like platform or sort of open ecosystem approach that they've adopted. It's one thing to make your own ambient solution, like they have their ambient notes, but also being aware that health systems will make various choices and may have different care settings where they're implementing tools. They've also partnered with others, including Microsoft, to offer like the DAX Copilot inside the workflow. And so, they're obviously responding to providers and practices' desire to have a choice rather than locking them into a single all-encompassing contract.
One way to think about Athena, I think, is analogous to Epic. Epic has been primarily anchored in academic medical centers, at least to start, complex care locations, whereas Athena's been on the ambulatory side by and large. And so you could kind of think of them as an Epic for ambulatory care, given their scale and their history. It'll be really interesting how they can empower these ambulatory sites in a world of consolidation where practices are getting gobbled up left and right.
They've obviously done a lot of work over the past few years as technology has really picked up steam and is moving so quickly in the era of AI. Ambient notes is one example, but I think they've gone a little bit further. And the other question is like, are they going to take even more market share in the ambulatory space? I'm also wondering, what's the long-term play here? So we talked about their corporate journey, and they recently had the transaction in 2022, and kind of curious to know what's next for them in terms of a company. Like, is there another IPO in the future? Is there some sort of massive acquisition with an AI player or a big tech company? They're sort of poised for that, right? Like they have the cloud-based infrastructure. And so that'll be something interesting to look out for over the next couple of years. And for listeners who have been bored by Trevor and I without Paul, just be aware that we're going to, after the theme music, we're going to have two Pauls. So we'll have our guest as well as our co-host, Paul Gerard.
The only thing better than one Paul is two Pauls.
Today, we are delighted to welcome Paul Brient, Chief Product and Operations Officer at Athena Health. Paul has a long career in health technology and has been at the forefront of healthcare IT innovation. And we're excited to learn more about his career and what Athena Health is up to. Paul, welcome to HealthTech Remedy. We're thrilled to have you.
Excellent. It's great to be here.
I wanted to go back to the beginning. I've read that you had a very early start in health technology, particularly even before you were officially an adult. So can you take us back in the time machine to understand a little bit about how you got your start in terms of innovating within healthcare?
Yeah, I had an experience that most people do not have in healthcare IT, but when I was early in my high school career, my father, who was a general surgeon, decided to leave academic practice and go out into private practice on his own. And so I had the formative experience of trying to help my father set up an independent healthcare practice. And of course, at least at the time, no one is taught how to run a practice when they go to med school. And so I can remember sitting with the CBT code book on my lap and a HCFA 1500 claim form that we were filling out with a typewriter to try to figure out how to get paid for the surgery he had just done. And that kind of translated into a desire to get an Apple IIe computer to, in full transparency, mostly play video games. Even back then, one wanted to play video games as a high schooler. But it morphed into me writing some software to make those to fill out those claims, which then morphed into writing an entire practice management system, an appointment scheduling system, and becoming the first vendor in the state of Florida to submit an electronic claim when those things were introduced. And I built a nice little business servicing physicians in the greater North Florida area before I went to college. And I took some time off after high school before going to college and just learned a ton about what it was like to be an independent provider. The biggest practice I had was 7 GI physicians at Digestive Disease Associates in Gainesville, but just learned a ton about the business of medicine and the challenges that people faced getting paid. And these were the good old days, as people refer to them now, but at the time they didn't feel so good because managed care was just coming to the forefront. The fun coda to that is that I had physicians using that software well after I had gone through business school and had my first couple of kids. When the second kid arrived, I had to call them and tell them that I was no longer going to support their Apple IIe computers. And it was like the year 2002. So it's also a testament to how wed people can be to their old technology.
That's remarkable. And can you, just before we move on to the rest of your career, I'd love to hear more about what you did after high school in terms of your educational journey and what that looked like.
So when I finally kind of pried myself away from the business, I went up to Princeton to study computer science. And then worked at the Boston Consulting Group in New York for a couple of years, mostly in their HealthTech practice. And then went to Harvard Business School and then went back to BCG briefly. And then couldn't resist and had to leave and join a healthcare IT company that had just gone public. So dove right back into the space and was there for quite a while. We sold the company to HBOC and they sold to McKesson. So I ran all the payer businesses for McKesson, making my previous clients hate me because I'm like, how are you working for those evil payers? And learned actually that payers weren't so evil. They were just playing a different game. And then joined a startup called Patient Keeper and focused on automating physician workflow in hospitals and spent 17 years doing that before selling it to HCA and working at HCA for 5 years before Athena. So it's been a healthcare IT journey for sure.
It sounds like in the earliest days, your business model was serving practices. And I think one of the things that we've seen in health technology is that actually technology can not just like submit claims and make sure that your father gets paid for the surgery that he performs, but also can change how physicians practice and empower physicians to provide better care. When did you first sort of notice that trend towards actually being part of the healthcare service and sort of improving the care that patients receive?
Yeah, that really came in my experiences at Patient Keeper. It was a startup company when I joined, focused on using the Palm Pilot to help providers collect charges as they round. And we morphed it into a complete physician experience, an overlay onto an EMR in the hospitals in the before meaningful use and after meaningful use. And what we found, of course, when you talk to providers is providers obviously lots of training, all kinds of good stuff, but especially in the hospital setting, I mean they are overburdened, right? A hospitalist covering the night shift has got 40 or 50 patients. And what we found was that rather than the kind of classic kind of CDS pop-up, right? Decision support pop up in your face. All you want to do is press escape to get those things going away. Like that wasn't a way to change behavior. But what we found is making the pathway that you wanted to do easy in the software was really a great way to do it. So it wasn't like, hey, this is CDS and you get the shock on the screen for not doing the thing that the computer thinks you should do, which you probably knew that already and didn't do it for a good reason. And so you have to explain it. But rather to put the pathways up on the screen in a passive way, through order sets, through suggestions, through single clicks, and make the things that you might otherwise forget just easy. So it becomes an easy thing to do or a helpful assistant rather than a kind of shock and awe approach that the early CDS systems have.
You've done all these great things in numerous different places. What drew you to Athena Health? What opportunity did you see there that made you say based on all my past experience, this is the next place I want to go?
I was I sold my company to HCA and I was there I think 5 years. HCA is an incredible company with an incredible culture. So HCA is the largest for-profit healthcare system in the country, and for-profit has different feelings associated with that in terms of healthcare, but it is an incredibly well-run company with an incredible culture. They have 200 or so hospitals. I'm probably getting it wrong now. I'll fail my HCA test, but 200 hospitals across the country, a whole bunch of ambulatory surgery centers and outpatient practices. And I had the opportunity to work with their senior leadership. And when I sold the company to them, they'd said, "Hey, we really want you to come spend the rest of your career here at HCA." And that's not usually what you do when you sell a company to another company. You tend to exit as a CEO. And they were right. I was very happy there and was contemplating going to run a hospital because that's kind of the thing you do with that company is you need to run a hospital. And I got a call from Bob Seegert, who had just won the bid for Athena, taking Athena private. And there were probably only one or two companies that I would have even taken a phone call from, and Athena's one. And it so happens that Bob Seegert was a business school classmate as well. Would love the opportunity to work with him, and I have loved the opportunity to work with him. And what an incredible project. Athena is such an incredibly well-respected company, and he had just grown and made a couple of strategic decisions at the time that weren't ideal, and just kind of got themselves stuck a little bit. And the idea on taking the company private was to unstuck and to really fulfill the mission of being a partner to independent ambulatory practices. And that was so it just tugged at my roots, right? When I made the decision, I told my mom that I was going to join Athena. She's like, "Oh, that's like what you did in high school." And I'm like, it is. It's just for 160,000 providers instead of 150 providers, but it is the same idea. And certainly a lot of things that I learned back then applied to my job today.
You talk about this needing to get unstuck. So when you joined Athena, what was your vision of what Athena would do, or how things would evolve in the foreseeable future?
Yeah, I think the wonderful thing about Athena is our scope and our focus on the ambulatory provider. I tell people that, hey, our job is to keep independent practices independent. There's so much consolidation going on. So many physicians are like, hey, I can't have my independent practice anymore. It's too complicated. I have to go join a health system. And, coming from a health system, those physicians aren't always the happiest ever, right? You give up a lot of autonomy. You're kind of told how to work. And that, at least in my view, again, coming from my background, there's a real opportunity to have independent providers who care for the patients in the way they want to care for their patients and can build a practice the way they want to build a practice. And those practices are lovely to be a patient of. And so we're really all about how do we help those practices be independent and focus on patient care and not have to focus on all of the other administrivia that the healthcare system throws at them.
Maybe in a very quick version, tell us a little bit about Athena Health and then kind of how it came to be, and then more importantly, where it is today. And we'll want to focus on the AI side and the product side of the present day. But I think it's important to set the table because I want our listeners to appreciate just the incredible role that Athena Health has had in health technology over the last 20 years.
Athena's got an incredible history. First of all, something that not everyone appreciates is Athena Health was founded as an OBGYN practice. So the founder's original vision was to create a network of OBGYN clinics. And what they found, which almost everyone who tries to start a practice finds, is it's really hard to get paid. And what they did, instead of what other people have done, is they decided to build a bunch of software to figure out how they would get their practice paid. And they built what is now the Athena collector system and realized that that was actually much more valuable than being a bunch of OBGYN clinics. And so they did a massive pivot, moved from California to Boston, and founded what is now Athena Health, the software company, and marketed essentially what you'd call a practice management system with embedded revenue cycle services. And that was kind of it is even today, one of the big differentiators is it's not just software. They continued to do work on behalf of customers. So not only were we going to give the software to do it, all kinds of cool ways of getting paid, a really powerful rules engine, but also a set of services where we, Athena, are doing a bunch of the work for our customers. And that's really what propelled the company to get going, to become a valuable, get past escape velocity, make money, do all things that companies do. And then with meaningful use, the company added an EMR to the equation very quickly, as most people did. And that was another big shot in the arm for growth. And then made a decision which we've reversed. So I can say, in hindsight, not the best decision, to try to go into the hospital space and build a hospital product. That proved to do two things. One is it's very hard to build a hospital product. The second thing is that it siphoned resources away from the core ambulatory product. And so the core customers were suffering. And that's kind of the time when our CEO, Jonathan Bush, and founder left the company. Jeff Immelt took over. The company is kind of put up for sale, and Bob Sigert Veritas won the bid, and then I joined. so that was kind of the strategic. Hindsight's perfect, right? It was not a great decision to go into the hospital space, and in the way it was executed, just wasn't serving the core customers well.
Yeah, I really appreciate that. That's such important context for not only Athena Health, but how the healthcare industry has evolved in our country broadly over the last 25 years. And Athena has been such a part of that on the health technology side in particular. So now on the present day, as you mentioned, serving over 160,000 clinicians with this cloud-based platform. Tell us a little bit about kind of what the product looks like today, and particularly in this world of AI and how connecting all these clinicians together, how you can optimize that.
Yeah, it's been an incredible journey. So I've been in Athena for 6 years. We just actually crossed 170,000 providers. So that's a fun milestone to celebrate. And really what we've done is we've focused all of our R&D on the ambulatory product and made it much more tailorable. So the original Athena EMR was kind of a one-size-fits-all EMR. And we have put a whole bunch of configuration in it, built it out for specific specialties. So that kind of out of the box, it works great for orthopedists. And we're really super excited about that. And then with this new generation of AI, we can solve a whole bunch of problems that we just couldn't solve before. And that's the super exciting part. Like I am more excited about the potential of technology today than I have in my entire career. It's just amazing. So what we've been doing for the past 2 years is going back through the whole stack and reassessing all the problems that we've solved. I mean, the problems haven't changed, right? But we now have this new tool that we can use, or set of tools that we can use to solve problems that weren't solvable before. And our terminology for it is the AI-native EHR, which is a little bit of a marketing buzzword, but basically what it means is, hey, we're going to rebuild Athena as if we'd built it from scratch today with AI. And that's all coming out over the next 6 months. But it just takes the EMR and turns it into this incredibly useful medical assistant that we all envisioned it would be when we conceived of EMRs. I think 1967 was the very first EMR out there, right? We conceived of this idea that a computer could be really, really, really helpful to physicians. And certainly, I think we've been around enough to know that not every physician views their EMR as a super helpful companion. But I think over the next 2 or 3 years, at least in the Athena space, they certainly will.
In terms of specific use cases, I think you touched on one. Another really hot area is ambient dictation, and how that can make clinic workflows better, decrease the burden on providers for their documentation burden, and so forth. Have you guys been working on that area at all?
Yeah, we released a product, we call it Ambient Notes is the name of our product, which allows providers to go into the exam room, put down their phone, press a button, have the computer listen to the patient-provider interaction, and at the end of that, generate a note. The cool thing is that we are in the process of taking that to the logical next step, which is after we generate the note, we'll list all the diagnoses that you might have talked about during that conversation, go back into the medical record, find any diagnoses that the patient had that you might not have talked about that should be part of the encounter. If you've suggested a medication, to tee up the medication orders and any other orders or referrals that you might have discussed with the patient, and have those all available. Now, we're not going to automatically order those things. You're going to get a screen and you're going to say yes, yes, yes. And maybe in the case of medication, you need to add some additional information about to make a fully qualified SIG. But to really have it do your encounter for you and then code it all up and make sure you can bill it and send it along. And, for us, the vision is we want to have the providers go in, see the patients, close the encounter, and be done. And there's, so much burden on providers and so much need to keep up with the schedule that sometimes you see providers who wait until the evening to do all their notes or billing, or wait till the weekends to do the billing. And that has, all sorts of hopefully obvious, not good consequences, both for the provider and for the practice. And we think with ambient, coupled with the AI interpretation of the transcript, and some other technology we're working on, we think we can make it so that almost every encounter is closed on the same day, and ideally before you see the next patient.
We see a lot happening with AI out in the world, AI hype cycles. I mean, I think I've heard it compared a little bit to the 90s .com boom as well. And we certainly are seeing AI hype cycles in healthcare. That doesn't mean there aren't, like the .com bubble, it doesn't mean there aren't good uses. But, of course, a lot of doctors lived through the .com era where everybody wanted to be a .com business, including your local coffee shop. So, when you start to look into healthcare and some of the skepticism that has emerged regarding AI-powered tools, what do you think are the biggest barriers, and how do you think you can get clinicians to start to trust AI and really understand that you're not just living in the world of hype, but you truly are talking about useful applications?
The analogy of the dot-com era is actually a very good one, especially in the capital market side, right? Which is in dot-com, there were gazillions of companies, and there are a few today, right, that have survived. I mean, Amazon made it through just fine, and it would have been a great investment, and there's many, many more that would not. And we're seeing a similar thing with .ai companies, right? There are gazillions of them. They're not all going to make it. However, just like the dot-com era, this is actually a real technology that's going to make a real difference. And I think if you're a physician that uses Athena, this is not a mandate thing, which is actually kind of cool. This is in my view, a go at your own pace kind of thing. And this is a technology that used well can really make a big difference to your practice and your life. If you think about the chart thing we were just talking about. And so our approach is very much go at your own pace. And the best kind of adoption push, in my view, is a peer. And the way we built Patient Keeper was very much peer driven. HCA became a customer of Patient Keeper because the doctors who used Patient Keeper at another hospital showed up at an HCA hospital and said, "Hey, I want this." And I think we find there are doctors out there that are very excited about AI and using it. Great thing about Athena is that we're a SaaS-based system, so it's available to everybody. Like, you don't have to do any work to get this stuff. Like, we just put it in there. You do need to decide to use it. And so our vision is very much, hey, how do we, in a given practice, find a few doctors who start using it? They start to tell their friends, and it becomes more of a viral, like, hey, this is a wonderful thing for you, as opposed to thou shalt use this, kind of like the way EMR started, right? We're not asking, we're just telling. Here we can kind of ask, and so we're building all of our AI in a way that it can be used incrementally and can be used when people are ready. And so it's not a big like binary switch, like you're either using AI or you're not. And some things, there are going to be just little things in the software that you will not know are AI, even though we'll put a little AI tag by them. But like one of the things it's a kind of a silly example, but a really powerful one, is that we get all this data from HIEs and other systems, and they come with very ambiguous titles like discharge summary. And if you click on it, you can read the discharge summary and know that it's from Mass General on June 1st, and the patient was discharged with whatever diagnosis. But you have to click on it to read on it. And so we're using AI to read those things and make the title much more descriptive, like discharged from Mass General on June 1st, for cholecystitis or whatever the thing is. Like it's like that can make the software much more delightful to use, even though you don't go, "Oh my God, AI just changed my life." It's like, no, now I get a list of things the way I expected it to be, or a little summary of that document. There's just a bunch of things that just throughout the software that will just kind of come without you having to quote unquote adopt AI. But then the big things like, hey, let's go use a new AI-driven encounter and use ambient and let it like that's a big change. And it's actually a big change in that you really will start to talk to your patients differently. And we're still learning about that. But if AI is listening and trying to build your note, there are things that you might say to a patient that you wouldn't have otherwise said, or the feature that we're excited to release relatively soon. Or afterwards, you can just put it in dictation mode and say, "I'm going to tell you a bunch of things that I want in my note." So that's going to take some time, and it's not for everybody, and it's also not for every encounter. Some encounters, like, you don't want to go through the rigmarole of having AI listen. It's like, I'm there for a wound check post-op. It's like, look at the wound, it's fine, talk to the patient for a while, and move on. Like you don't need that complex setup process. So it's fun. It is. I think it really is bringing a tool to providers that's going to make a big difference, and let's let them adopt at the pace that makes sense for them.
You just mentioned this idea too of maybe it's AI is not optimal in every situation. Are you noticing particular specialties or practice types where adoption may be faster or slower?
I'm a little surprised in that it seems to be more about the provider than the specialty at this point. Certainly the more complex a visit is, the better AI is. But almost every provider has certain, not every encounter, but some visits are like, you got a new patient, you're working them up, you got an annual wellness visit, you're evaluating someone for surgery. Those are more complicated, longer visits where it's really helpful to have AI listen to it all and capture it all. And then there are shorter visits. Everyone has shorter visits. It's not. And so we don't see 100% adoption on an encounter basis, even for the providers that are like, hey, I love this thing, I'm using it all the time, because it doesn't make sense every time. And we're totally supportive of that. But it really is, so far appears to be fairly ubiquitous across our specialties. Like, we're seeing a pretty good adoption throughout the specialties we serve, and we serve just about every specialty. Um, it's a very, very neat and kind of groundbreaking technology. Which, again, if you go back to the Wall Street thing, Wall Street's way overhyped on this stuff. Like, there are hundreds of companies doing this because it's such a good idea, and we don't need hundreds. We need a handful or two. So we'll see how that works its way out through.
An amazing capability of you all is the 170,000 clinicians you're reaching. So can you reflect a little bit on how you measure the success of these innovations? Maybe what metrics, or how do you ultimately measure the impact on the patient level? Or can you reflect a little bit on that?
Yeah, we are incredible data geeks, and because we have a SaaS system, we literally have, there's only one Athena One system, and it's for everybody. And so we can gather all the stats about how everyone is using it, all the outcomes, all the good stuff. And so we, for the AI stuff, we look a lot at what we call pajama time, which is, we know when you're working, when you're not seeing patients after hours. We know that. So we can track and see how much time providers are spending. We know how many encounters are closed on the same day and how many encounters are closed at roughly the same time as the appointment. Like, so we know all those things. We look at those things, and then we can correlate that with, okay, here's a provider, they adopted ambient notes on June 1st. We look across the next month or two and see how they're doing on those metrics. And the answer is, they're doing a lot better. like you can see it. You can see the same day encounter close rate go up. You can see the pajama time go down, and it's really great. And so we learn from that. We learn how to optimize the software. We see which encounters are using it for or not. I love to go out and spend time with our providers and talk to them about the analytics. So, hey, we've observed that, on Wednesdays, you're not using ambient notes. Why? Right? It's like, and you learn stuff, and maybe it's because it makes sense, or maybe it's because the software is doing some weird thing. And we work to optimize it.
It's been fascinating to hear about the work you're up to. I'd like to transition to, as we approach the end, a little bit of your thoughts about maybe career and making an impact within health technology. So first, just for thinking about folks who are interested in health technology and really want to improve how consumers, receive healthcare and how providers practice. Based on all of your numerous experience over the years, starting back from even before college, what have you learned about driving change in healthcare?
Wow, that is a very interesting question. So I think that maybe until recently, perhaps, but certainly historically, change is hard. The healthcare system works in ways that do not make intuitive sense to people that are outside of healthcare. So I have a speech that I give people when they're taking their first healthcare job. The rest of the economy works very, very differently, because my view of root cause is that the consumer picks the product, pays for the product, and benefits from the product everywhere else. And in healthcare, we've separated those roles across three different entities. And so it creates all kinds of weirdness. And you come into healthcare and you say, gee, I don't understand why it isn't better, and people want to change it overnight. And what you really have to do is you have to go back to the, why is it like this? Like, it's not full of a bunch of numbskulls or Luddites or whatever. It's a very complicated system that has a bunch of different economic rules and different benefit rules than the rest of the economy. So you can't take rest of economy solutions and apply them directly to healthcare to drive change. You have to really understand why the system is the way it is and work within that context to drive change. And it's just hard. It's I think we keep seeing the percentage of our GDP applied to healthcare go up and up and up to levels that, when we first started looking at it, at least I started looking at it in the 90s, we said, boy, it could never be above 16%. Now it's like 18 something. So it can be, and it continues to go up. And frankly, one of the things that I think is frustrating about the U.S. healthcare system is that we have both the best and worst healthcare in the world simultaneously. And I think, those of us in it, at least me personally, would love to see if we can, bring that the worst up, so that that everyone in the U.S. can benefit from a wonderful healthcare system.
Paul, we really appreciate you taking the time and joining us today. It's been an amazing conversation.
Really enjoyed it. Thank you all. Appreciate it.
Well, that's it for this episode of HealthTech Remedy. Don't forget to subscribe, rate, and share the show. It really helps support our mission. Looking forward to seeing you all next time.